Good morning, everybody. My name is Boris Mendoza Menendez, and my topic is Alpha 1 Antitrypsin Deficiency. We have subtopic in the introduction, we have the definition. Alpha 1 Antitrypsin Deficiency, or AAT, is an inherited disease which disables sufficient production of AAT in the body. This protein is produced in the liver and works to protect the lungs and liver from damage. AAT deficiency means that there isn't enough of this protein in the body. This is caused by a genetic defect. The condition is more common among Europeans and Americans of European descent. This condition can lead to COPD and liver disease such as cirrhosis. Adults with severe AAT deficiency develop emphysema, often before age 40. Smoking can increase the risk of emphysema. Medical synonyms: AAT, AATD, alpha 1 protease inhibitor deficiency, alpha 1 related emphysema, genetic emphysema, hereditary pulmonary emphysema, and inheritary emphysema.
Alpha-1 antitrypsin deficiency is a rare disease which causes liver problems in children and also adults, and causes lung disease, which is described as emphysema in adults. And it's the most common genetic disease for which children undergo liver transplantation. I have been doing research on alpha-1 antitrypsin deficiency for more than 30 years, and it's quite remarkable how much we've learned. We've now gotten to a place where our research has discovered several different ways to potentially reverse the problem.
Application in medicine. We have causes. Mutation in the SERPINA1 gene causes alpha 1 antitrypsin deficiency. This protein protects the body from a powerful enzyme called neutrophic elastase, which fights infection but can attack tissue, especially the lungs, if it isn't controlled. Alpha 1 antitrypsin shortage, causing it to be unable to control neutrophic elastase. Symptoms: difficult breathing with and without effort, and other symptoms of COPD. Symptom of liver disease, involuntary weight loss, and wheezing. Diagnosis: a physical examination may reveal a barrel chest, wheezing, or decreased breath sound. Also use AAT blood test, arterial blood gas, chest X-ray, computed tomography of the chest, genetic test, and lung function test.
Today's video we're going to be discussing alpha-1 antitrypsin. So let's begin. What is alpha-1 antitrypsin? Well, it's a protein which is present in the blood and in the bodily fluids. What does alpha-1 antitrypsin do? Well, it inhibits a number of proteolytic enzymes that hydrolyze and destroy proteins. It also inhibits an enzyme called elastase, which is secreted by the neutrophil, which is a type of white blood cell. And what this enzyme does is it degrades the elastin of the alveolar walls. So, where is alpha-1 antitrypsin produced? Well, most of it is synthesized and secreted in the liver, and some is also produced by monocytes and alveolar macrophages. So, what is its role in the lungs? Normally, the alveoli are exposed over a certain amount of time or chronically to low levels of the enzyme elastase, which is produced by the neutrophils. So what happens is the elastase which is produced destroys the elastin of the alveolar walls of the lungs. However, alpha-1 antitrypsin is an inhibitor of elastase. So what this means is if an individual has low levels of alpha-1 antitrypsin, or they have the inherited disorder alpha-1 antitrypsin deficiency, there's greater destruction of the connective tissue in the alveolar walls of the lungs, which will eventually result in emphysema. This is the video on alpha-1 antitrypsin. Thanks for watching. If you have any questions,
Pros and cons. Pros. The advantage begins with easy treatment such as quitting smoking, in addition to using symptomatic treatment depending on the characteristic symptoms for COPD and cirrhosis. There is another treatment that involves replacing the missing AAT protein. The protein is administered intravenously every week or every 4 weeks. This is only slightly effective in preventing for the lung damage in people without terminal illness. This procedure is called augmentation therapy.
Alpha-1 antitrypsin deficiency is an inherited disorder causing a decrease in production of the alpha-1 antitrypsin protein, or AAT. In healthy individuals, AAT is produced by the liver and released into the bloodstream. AAT circulates to the lungs, where it protects against inflammatory proteases. In a subset of patients with the most common mutation, AAT accumulates in the liver, leading to lower AAT circulating levels and sometimes to liver disease. In the absence of normal circulating levels, inflammatory damage in the lungs is increased, causing irreversible tissue damage. Our lab is developing a novel gene transfer therapy using adeno-associated viral vectors, targeting liver and lung diseases with a silence and replace strategy called dual function vector. It consists of inhibiting the mutant gene affecting the liver using an artificial microRNA and restoring circulating levels of normal proteins by bringing a functional copy of AAT. To ensure artificial microRNA won't turn off the introduced normal gene, the functional AAT gene is engineered to be resistant to its effects. Injected in the cephalic vein, the vector directly targets the liver. Results show that microRNA reduces defective AAT in liver cells while simultaneously producing protective, functional AAT protein. This dual-function vector presents a first-in-class approach targeting both lung and liver diseases in patients with AAT deficiency.
Cons. This disorder affects approximately 1 in 1,500 to 3,500 individuals of European descent. COPD can be caused by alpha-1 antitrypsin deficiency. However, alpha-1 antitrypsin deficiency is often never diagnosed. Some people with alpha-1 antitrypsin deficiency are misdiagnosed with asthma. Issue of play in Ecuador. A recently published study of frequency of the C outlet and the prevalence of the CC phenotype in the world conclude that the greatest number of people with severe CC deficiency is found in Europe, followed by America, being less frequent in other continents. By the way, no specific case of alpha-1 antitrypsin deficiency were found in Ecuador.
Antitrypsin deficiency is actually a hereditary lung condition in which you are born with a certain gene that helps ward off infections and stuff into your lungs. So without this gene, when I get an infection, it actually attacks my lungs rather than protect them from illnesses. When I was first diagnosed in 2001, I didn't really have too many symptoms. I knew that I had it. My father was tested, and my mom was already positive. So at that time, we knew that chances were pretty high that I was going to be a carrier, but also have the deficiency. My symptoms weren't real strong. I had some shortness of breath upon exercise, going up hills, steps. So back then, it wasn't really a game changer in my life. I knew I had it, so I tried to take care of myself. And with this disease, it just progressively gets worse. There is no treatment for this disease at all. It's just a matter of taking care of yourself and doing some preventative measures. In October of 2016, my oxygen levels were pretty low upon seeing my physician. So at that time, I was put on oxygen. Wasn't quite 24/7, but I did have a portable in case I did go out and get shortness of breath. But the oxygen was full-time at night. By January of 2017, I was unable to go up steps anymore without really stopping using my rescue inhaler. And from there, it seemed to take a steady decrease to the point where we're at now, which is, it doesn't take much activity anymore to get that shortness of breath to come on. The best course of action I have, of course, is my rescue inhaler. And with the oxygen, just taking some low, deep breaths seems to help kind of get my oxygen level back up. And of course, just stopping and resting what I'm doing. Just making sure that I sit down, relax before I get up and attempt any kind of activity again. But definitely the inhalers do help, and the oxygen. Their only long-term cure for the alpha-1 and now the very severe COPD that I have is a lung transplant. If you have any doubt, get tested. Alpha-1 antitrypsin it's detected with a blood test. It's very easy, very painless. It's a struggle when you have to breathe and can't get that deep breath. So I would say just as much prevention as people can, and get tested and know what's out there, and take care of yourself while you can.
Conclusion. The AAT is a genetic disorder with high underdiagnosis. In a COPD patient, AAT levels should be determined at least once in life. A specific treatment with intravenous AAT is effective in reducing the progression of emphysema and should be indicated in patients who meet criteria after being evaluated by an expert. New methods of rapid genetic diagnosis can be useful to reduce underdiagnosis and achieve an early diagnosis of those affected.
Liver cells, known as hepatocytes, produce a protein called alpha-1 antitrypsin. After production, alpha-1 antitrypsin is transported out of the hepatocytes and into the bloodstream. Alpha-1 antitrypsin is then delivered to the lungs and down to the small air sacs known as the alveoli. Alveoli are responsible for the exchange of carbon dioxide with oxygen. Neutrophils are white blood cells that produce neutrophil elastase, an enzyme that aids in the destruction of bacteria. Neutrophil elastase is important for maintenance of healthy alveoli. However, if left uninhibited, neutrophil elastase may continue functioning and destroy healthy lung tissue. Alpha-1 antitrypsin inhibits neutrophil elastase, preventing the destruction of lung tissue. Patients with alpha-1 antitrypsin deficiency have an insufficient amount of usable alpha-1 antitrypsin. Some alpha-1 antitrypsin is mutated and unable to inhibit neutrophil elastase. The uninhibited neutrophil elastase will act upon lung tissue, diminishing the number of alveoli. Reduced alveoli reduce the amount of carbon dioxide converted to oxygen, making breathing more difficult. Alpha-1 antitrypsin can result in emphysema, chronic obstructive pulmonary disease, and other lung conditions.
Thank you for watching, and thank you for your attention.